In Spokane County, 30 more people were diagnosed with the virus in the last 24 hours.
And that rise in cases is one reason why Spokane has been stuck in phase 2 for more than a month now. Mayor Kawash has been tracking the numbers. The mayor, the chief health officer, told you he's not optimistic about moving forward.
Yeah, at least not right now. And a big part of that has to do with this graph. Now, no one in the county has died from the virus for 14 days now. Pardon me, that's actually 15 days now. But Dr. Lutz says other trends don't look great. And this is your example for that, showing you community spread. Now, you see all the orange on this screen, and that represents cases that are linked to other known cases. That's a good thing. As long as health officials know how that person got infected, it's considered somewhat contained. But this blue here at the bottom right, 622, is what's holding us back. This represents cases that are not linked to others. That means there's community spread going on, and that represents about 30% of our new cases. 295 people in Spokane County have tested positive for COVID-19 just in the last 14 days. So where did those people actually get infected?
I look at events around Memorial Day, I look at graduation ceremonies, and then I find, unfortunately, that what we're seeing is people going out, young people going out to bars.
About 40% of the county's confirmed cases are tied to people that are 20 to 39 years old, many of them not symptomatic, but they can easily spread COVID-19 without even knowing. Dr. Lutz also says protests over the last few weeks have not been a factor in these new cases. He says there are just 5 total cases linked to the protest on May 31st. He also believes 4 of those people were already infected before attending.
I would argue, and I think the data demonstrate, that it is not the protests, it is rather people's behaviors.
We also know more testing means more COVID-19 cases, but more testing should also mean more negative results. Right now, that's not happening enough. About 5% of tests in the county are coming back positive. The State Department of Health wants that to be near 2%. So to get there, the county has to test twice as many people.
We just need to see positive trends, and right now my trends are anything but positive. You know, we talked early on about flattening of the curve. Our curve is on the ascendancy, not on the flattening.
We know hospitalizations are the other key factor in reopening, and right now 14 Spokane County residents are receiving emergency care for the virus, and then there's another 14 out-of-county patients also receiving care here in Spokane County. Now, Dr. Lutz says we may see more patients coming in from Yakima County soon, and now with this massive rise in cases and testing still lacking, it's clear that we're still a bit far off from phase 3. Aaron?